लेना एक बार चेक कर लेना।
यदि देखिए
हाँ
दिखाओ, क्या दिखा रहे हो?
नहीं
वो
सर्टिफिकेट बोले दिखाया था तुम्हें।
दिखा दे।
हाँ सर्टिफिकेट
देखो शुरू हुआ है, देखो एक बार
भेजो, फिर से भेजो।
YouTube
अरे
वीडियो।
स्क्रीनशॉट
शुरू हो गया भैया
हाँ हाँ
ना यूट्यूब
स्क्रीनशॉट एक से मैं करता हूँ।
हाँ ऐसे रहने में तो
आ गया, हाँ लाइव आ गया।
55,000 रहने दो।
नहीं सर्टिफिकेट बोले
भैया
भैया गूगल
आ
मीट
रहा
पे
है,
जा रहा है आवाज।
गूगल मीट का ऑडियो आ रहा है।
भेजो, फिर से भेजो।
भैया
कितने मिनट्स डिले है?
1 मिनट डिले है
भैया इधर का मीटिंग का जा रहा है। ये फाइनलाइज पे
हो गया ठीक हो गया।
अभी सही है।
एक सेकंड मेगापर्णा मेगापर्णा दी कैसे दी?
अरे रुको
सॉरी यस
आ रहा है।
आ रहा है
अरे इट इज ऑफ ना
भैया। सोर्स ओबीएस सोर्स ऑन किया है क्या? ओबीएस का माइक सोर्स
नहीं
इनपुट
OBS
सोर्स
का
ना कुछ
सोर्स
देखिए।
मतलब गूगल मीट ऑन नहीं हुआ अभी तक। कैसे आ रहा है?
भैया पूरा आ रहा है।
हाँ वैसा हाँ देखता है। तुम लीना को भेज देना, लीना एक बार चेक कर लेना, उसके बाद ईमेल कर देना इट्स पार्टिसिपेंट्स को।
मैं अपना असाइनमेंट दिखा दूंगी।
ठीक है
एक बार दिखा।
मेरा आवाज सुनने में अच्छा नहीं लग रहा है।
भैया सच बोल रहा हूँ, पूरा ऑन है भैया, बंद कीजिए।
अरे बांध दे कैसे आ रहा है?
पता नहीं भैया।
मैं सुना रहा हूँ आपको।
बंद कर दो जो भी ऑन किया बंद कर दो। खुद का आवाज नहीं सुनना है मुझे फिर से, अच्छा नहीं लग रहा है।
भैया
एक सेकंड में म्यूट करके चेक करता हूँ।
आ रहा है।
We cannot keep the board of this way. बताना पड़ेगा।
कैसे आ रहा है?
पूरा आ रहा है भैया।
भैया इसलिए हम बोले थे सिंपल सा कर लेते हैं पहले आज के लिए।
OBS से तो पूरा ऑफ है, मॉनिटर एंड आउटपुट दोनों ऑफ, तो कैसे आ रहा है?
भैया आपका लैपटॉप का माइक्रोफोन से आ रहा है क्या? आई डोंट नॉट नो अबाउट दिस यूट्यूब स्टफ।
हाँ ये हो सकता है।
बिकॉज मैं यूट्यूब एंड वी कैन नॉट कीप द बोर्ड ऑफ दिस। भैया आपको रिस्टार्ट करना पड़ेगा, स्ट्रीम रिस्टार्ट करके डिलीट कर दीजिए, बेहतर होगा।
अच्छा बाकी पार्टिसिपेंट्स को अभी बुलाना शुरू करें या नहीं?
एक सेकंड, इस यूट्यूब स्टिल माइक से आ रहा आवाज आ रहा है ना? नहीं आ रहा, चेक करो कोई। मेरे तो इधर नहीं आ रहा है। I think it's fixed. Maybe. नहीं नहीं fixed था शायद से.
भैया पूरा आ
फिक्स
रहा
नहीं
है,
है. फिक्स नहीं है.
पूरा आ रहा है।
छोड़ो, वो पार्ट उठा लेंगे, एडिट कर लेंगे बाद में. अभी कोई व्यूअर भी नहीं है वैसे.
भैया लाइव चल रहा है, किसको एडिट करेंगे आप?
नहीं, अगर रखेंगे वीडियो वापस रिटर्न करके बता देंगे वो आगे का बात.
वीडियो तो क्यों चाहिए जब वायर से लाइव चल रहा है ऑलरेडी। सिर्फ रील में डालने के लिए शायद वीडियो चाहिए होगा
यस.
इंस्टाग्राम में। उसके लिए तो कुछ भी बीच से काट लेंगे, वो दिक्कत नहीं।
Good afternoon, everyone. My name is Shithan Ghosh, and along with Swaminatha Bhatt, Anubha Khara, and Gaurav Biswas, on behalf of YRC Kit, I would like to welcome each and every one of you to our webinar, Fever Frenzy, No Dengue and Malaria. Dengue and malaria are very prevalent diseases during the monsoon season, and proper knowledge of the spread and prevention of these diseases is crucial for staying safe and healthy. By understanding these diseases, we can ensure proper action and measures to keep ourselves and those close to us from falling ill. Today's talk promises to be interesting and informative, but before we get started, we would like to introduce our esteemed guests. I would like to warmly welcome our speaker for today, Dr. Meghaparna Mandal. Now, I'm sure a lot of you are wondering what this society is all about and who we are. To answer this, we have prepared a presentation for you, which will give you an insight into what we do here. I would like to warmly welcome our speaker for today, Dr. Meghaparna Mandal. Now, I'm sure a lot of you are wondering what this society is all about and who we are. To answer this, we have prepared a presentation for you, which will give you an insight into what we do here. Youth Red Cross is a subdomain of the Red Cross, a non-profit organization that seeks to aid humanity and foster peace and ensuring health and safety for everyone. Our motto is through humanity toward peace, which we take great pride in achieving. We here at YRC Kit aim to consolidate this vision through various social activities such as blood donation, Nukkad Natak, cleanliness drives, village visits, and awareness programs. Here, you can see the various activities YRC Kit has participated so far. We have arranged blood for more than 250 needy people, hosted various camps, organized Nukkad Nataks, went for clothes distribution, and visited old age homes to spend the weekend with them. We have also hosted industry training camps here at our university and performed clothes distribution for needy children. The volunteers of Youth Red Cross have also visited an old age home in Aryapalli. This helped us to connect with the old people and make their days and lives a much better place. The volunteers of YRC Kit have also performed a Nukkad Natak at Bhubaneswar railway station in 2019 on the topic Swachhata Hi Seva. Blood donation is one of our most important domains, and we take great pride in saying that we have the fastest response team with highest number of achievements across this region. On the occasion of World Red Cross Day, which is celebrated to commemorate the birth anniversary of Chen Henry Dunant, the founder of Red Cross, IRCS OSP organized a walkathon from Raj Bhavan Bhubaneswar to Red Cross Bhavan Bhubaneswar. The theme Be Humankind. The volunteers of YRCK also participated in this. Here you can see some of the other blood donation awareness work that we've performed over the years, such as the one you're attending right now. We also host other online events. One such event was the role of a volunteer in disaster management. This helped update our volunteers on the different ways they can help during disaster and crisis. Here you can see another one of the events where we distributed clothes for needy people. On World AIDS Day, we have performed blood donation mega camp with collaboration with HDFC, which was a resounding success. During Road Safety Week, our team performed a Nukkad Natak on the theme Road Safety. Last year, during the Silver Jubilee, YRC Kit, in collaboration with Kit DU, hosted a mega blood donation camp on 15th February. This was a resounding success, and we were congratulated by the founder himself. We also participated in study-cum-training camps, which help us to keep up to date with the latest trends in first aid and blood donation. Here's some of the achievements that we've achieved so far. We also conduct regular first aid training to keep our volunteers up to date on the latest trends so that they may be able to use them when needed. One of our biggest achievements so far is donating the blood for Balasore train accident victims, which has helped save many lives. In addition to the ones already mentioned, Kit YRC also participates in many activities, such as the one mentioned here. I hope this small presentation has given you a brief idea on who we are and what we do. Any questions you may have can be answered in the Q&A session. In addition to the ones already mentioned, Kit YRC also participates in many activities, such as the one mentioned here. So, without further ado, I would like to present our speaker for today, Dr. Meghaparna Mandal. Dr. Meghaparna Mandal is a doctor at KIMS with honors in physiology, pharmacology, microbiology, obstetrics, and gynecology. She graduated with second position in class and has been a part of various seminars and community engagement programs in the last 4 years. She's also a valued member of our YRC community and takes great pleasure giving back to the community and helping others. We are truly delighted to have her here with us today. Over to you, Dr. Meghaparna.
Thank you for the welcome, Siddharth. Uh, it feels really surreal to be on the other side presenting and not being an attendee of such programs. But here we are. So, without wasting any more time, I'll jump straight to the topic and I'll be talking about dengue and malaria, which are tropical fevers. Generally, we'll see a rise of incidence of these diseases during the monsoon months. Tropical fevers, as the name suggests, are the ones which we see in the tropical areas and which are also associated with the local flora and fauna of the region and is more prevalent in the regions which receive heavy rainfall. So, in India, it is prevalent in the eastern belt, including West Bengal, Orissa, and along the Gangetic Plain. So, both these diseases, dengue and malaria, are vector-borne diseases, which means that the causative agent is carried by a different organism before it reaches the human host. So, in both these cases, as I'm sure all of you will know, is like the diseases are transmitted by bites of mosquitoes. There are further divisions of the type of mosquito that causes the various diseases, but I do not think that we need to go into that because for the general population, we need to prevent ourselves from mosquito bites in general. So, also at this point, I'd like to clarify a fact that while dengue and malaria are not contagious in the sense that if one patient is infected with dengue or malaria, a person touching them will be infected too. It is not contagious. However, if a non-infected mosquito bites any of the patients who are already infected with dengue or malaria, there is a chance that the mosquito then gets infected itself and can further propagate the disease. I am sure all of you will know that the main and the most common symptoms of dengue or malaria are high grade fever, headache. Classically, in case of dengue, we say that the patient complains of a retroorbital pain, which means that the patient, or if any of you or your family members have had dengue, you will say that the like I am having a headache and it feels like the back of my eye is paining. So this is a classical symptom of dengue fever. Associated with these symptoms, there will be muscle weakness, chills, rigors, weakness, and there might be decreased urine output if there is dehydration. In cases of complicated malaria, there might be associated nausea, vomiting, loss of consciousness, or blood in urine, which we call hematuria in our medical terms. In cases of complicated dengue, there might be bruises and rashes all over the body or bleeding from nose or mouth. These are signs of a complicated illness. At home. For diagnosis of the disease, there are specific blood tests. For malaria, we'll do a malaria parasite study, and for dengue, we'll do an NS1 antigen. However, these tests will only identify the cause of the illness and not the severity. So, a lot of you might be having friends or family members who are doctors, and you've heard these terms and the names of these tests from them. It is ideally not suggestible that you go ahead and do these tests by yourself in case you have high fever or high grade fever with any of the above mentioned symptoms, because these tests only identify the cause of the disease. They do not identify or assess the severity of the illness. However, if you do go to a doctor or to a clinical setup, they will prescribe additional tests to assess your liver functions, your kidney functions, the involvement of your nervous system, and the immune response of your body. Like I'm sure all of you have heard that whenever someone is infected with dengue, there is a alternate day platelet count test that is done. That is because of the immune response to the fever often affects the platelet count of the body. Again, the course or the severity or the fatality of the disease varies from person to person. Not only does it vary from person to person, it varies also on the kind of antigen, the specific species of antigen in case of malaria that is affecting the or infecting the patient. Also, in cases of dengue, the severity and the course of the illness depends on the number of times the person has been infected. So, if a person has been infected previously with dengue, the course or the clinical signs and symptoms are likely to be more severe and the disease is likely to be more fatal in such a patient. If we come to the management of the disease, malaria is caused by parasites, and we have available anti-malarial drugs present to treat the disease. It is easily treatable. However, depending on the specific species of plasmodium that is infecting the patient, the drugs differ. Some of these can be treated at an outdoor basis, where the patient is given a set of drugs which they are supposed to take. By drugs, I mean oral tablets, which they are supposed to take on specific days at specific times, and then they can follow up in the outdoor. However, in cases of more severe illnesses, which are generally called as cerebral malaria, or in cases of severe malaria, we will prescribe intravenous drugs. For this, you would need to be admitted. These are not drugs, while we know that anti-malarial drugs might be commonly known among the population, such as quinine and hydroquinone. These cannot be self-medicated because these drugs are higher grade antibiotics which need to be monitored in a hospital setup. So, and not only do we need to monitor the drug that we are giving, we need to also monitor the response of the various systems in our body, such as the liver and the kidney, to these drugs, and prevent toxicity to these drugs, along with the drugs that are given for malaria. Because it is a highly febrile condition, there will be associated dehydration. If the liver is involved, there might also be associated hypoglycemia, which is that the blood sugar levels of the body decreases. So, in the hospital setup, these things will also be taken care of. So, to reiterate the fact that no matter how well connected you are to a doctor, or whether you are in the process of becoming a doctor yourself, it is not advisable to self medicate or self treat either malaria or dengue. If we come to dengue, dengue is a viral disease, and there are no antivirals available as of now, which specifically target the dengue virus. However, we provide symptomatic management, which is we'll reduce the fever, we'll reduce the body pain, we'll reduce whatever other problems that the patient is having, and we'll give fluid replenishment under monitoring. The most fatal situation in dengue is the sudden drop that happens in the platelet count, which leads to life-threatening hemorrhage. Spontaneously, there will be hemorrhaging from various vital organs, and it leads to spontaneous death. So, also there is a trend in dengue fever where sometimes after the fever subsides, the drop in platelets continue, which is why monitoring in case of dengue fever is very vital. Uh, Once you go to your general physician or the doctor treating you and you have a dengue fever positive report, The doctor will further decide, depending on your current blood reports, as to how you could be managed. He will likely prescribe a alternate day platelet count test for you while giving you symptomatic medications to relieve your symptoms. Uh, if the doctor sees a falling trend or he sees warning signs that are suggestive of a fatal course of the disease, he would probably ask you to get admitted. And in case that the platelet count drops below a certain level, that level varies from hospital to hospital, protocol to protocol, and based on the region. Uh, if the platelet count drops below a point, you might require platelet transfusion. So, in this case, dengue fever cannot be managed like other viral fevers on an outdoor basis, and you would have to be admitted. In both dengue and malaria, there might be liver involvement. So it is best to not self-medicate, as some of the antibiotics that are available as over-the-counter drugs and can be bought and used by any of you without a prescription have hepatotoxic effects. That is, they worsen liver function. Especially in children, it can lead to an acute liver injury. Hence, it is best to avoid self-medicating or even, you know, like just assuming that you have a fever and it can be managed in a particular way. In very severe situations, we have also seen patients who have had both dengue positive and malaria positive reports. So just because you have one doesn't mean you don't have the other. Obviously, doesn't mean you have the other either. But both these diseases, while they sound very benign, it might sound like any other febrile illness, such as seasonal cough, cold. These both of these have high fatality and have led to massive outbreaks with high mortality indexes. So it is best to get treatment or get advice from a clinical setup or from an authorized doctor. In both these uh, infections, if you have say a stable outcome, or the doctor asks you to stay at home and advices for outdoor management, then it is advisable that you hydrate yourself with ORS, which should also not be done on a self-medication basis, but only on the advice of the doctor. There are concepts of home remedies to both dengue and malaria, and you'll hear about drinking papaya juice, you'll hear about having special fruits like kiwis or something. I am not going to deny that these have any evidence-based outcome, but I also do not have any literature or any textbook references that support these. So while I will not say that these do not work, because not everything can be explained by science all the time, I would also encourage you that not to solely depend on these home remedies, but to supplement the medication that we give or the medication that is suggested with home remedies. Apart from all of these, the government has initiatives in every state and in every part of the country, even in villages and at the grassroots level, to prevent the spread of this the spread of both malaria and dengue and other diseases which are borne by mosquitoes, such as Kala Azar and Chikungunya. These are covered by the National Vector-Borne Disease Control Program. It is a national health program which has various levels of community engagement programs and action. However, because of the health burden load, and the unavailability of resources in a low resource country setup like India, a lot of these functions and a lot of these benefits do not reach the common public. However, as a team such as YRC, where we are looking out for the benefit of the community and we're engaging in such programs, I would like to discuss the strategies that the National Vector-Borne Disease Control Program has in place to prevent or to reduce the spread of these infections. And we could, as a community, as a society which engages in community awareness, we could also discuss these and adopt these strategies for reduced infection and better infection control. So the National Vector-Borne Disease Control Program advocates for integrated vector management, which means that for every level of the lifespan or the life cycle of the vector, there is an intervention to stop the disease progression at that level. So the first step that we have is source reduction. We know that mosquitoes breed in water. Some mosquitoes breed in stagnant water while others breed in fresh flowing water like ponds and rivers. However, the disease control program suggests that any kind of stagnant water in households, such as water in tubs, in pots, in utensils, in buckets in the washroom, in open drains, should be controlled. Second, we have personal protection. These include bed nets, especially in areas which have a high disease load, and using repellents. These repellents can be in the form of, like these oils or creams, whatever. According to the government, the bed nets which are present are also sometimes supplemented with repellents on the bed nets. So these further help for eradication or decrease of the infection. Natural substances like lemongrass oil, eucalyptus oil, and neem oil act as repellents and can be used for the same. And chemicals such as diethyl toluamide are used for the same. Moving beyond personal protection and source reduction, we have anti-larval and anti-adult methods which are advocated by the government. Anti-larval methods include larvicidal agents, which are regularly sprayed into your drains and into your ponds and lakes by the government. The anti-adult methods include this fog spray, which I'm sure some of you might have seen. Sometimes on the campus itself, they will go around with a fog spray kind of machine, and then it fills up the area with like a foggy smoke, and that uses the chemical DDT or malathion in most cases. So these are the ways in which not only the government but every healthcare worker or professional would suggest. Some of these can be done at a private level, personal level, while some of these are healthcare initiatives taken by the government or the local clinical resources. So I would like to conclude my talk here, and I would like to leave you with the take-home message that if in the monsoon or if at any other time of the year you have you or your family members have high-grade fever associated especially with body ache, chills and rigor, please visit a doctor. Please get tested. Please ask your doctor to get you tested for dengue and malaria. While these might seem as benign conditions, it can take a fatal course. Do not self-medicate. Always take advice from your doctors. Protect yourself and your family against mosquitoes. It takes only the simplest of precautions like using a mosquito net, using mosquito repellents, and stay safe. Thank you. If any of you have any questions, you can please ask.
Thank you, Dr. Meghaparna, for your very insightful, very informative discourse on these diseases. I'm sure everyone here will have gained some valuable knowledge that they will be able to use in their daily lives. We are starting the Q&A session now, so we are open to questions. Please feel free to raise your hand or unmute and ask. Put your question in the chat box. We can see we already have a question here. Priyam Panda, yes, go on.
Good evening, ma'am. Ma'am, I wanted to know that what other additional symptoms a person having comorbidities like diabetes may face while suffering from dengue or malaria.
Yes, that's a very good question. Patients who have diabetes, as such, already have reduced kidney function in most cases. They also might have associated cardiovascular diseases, and patients with diabetes, especially, might be on drugs which reduce their blood sugar levels. So, in a patient as such with diabetes, the symptoms might be exaggerated. However, some of the symptoms might also not manifest in the ways that it manifests in the general population. For example, if a person is on insulin, when the when a patient is having a acute infection such as in malaria or dengue, the insulin requirement of the body increases, right? So the patient will have hyperglycemia, that is, there will be increased sugar levels. In the general population, these diseases might present as hypoglycemia, that is, reduced sugar. However, in case of a diabetic patient, the symptom will be hyperglycemia or increased sugar levels, right? So, these and additionally, if there is kidney or liver dysfunction in patients with diabetes, that might worsen and the patient might present an acute kidney injury or acute liver injury. However, this is not to say that every patient who has a comorbidity such as hypertension or diabetes will have a severe symptom or a severe illness, but they might have altered symptoms or presentations. And thus, if you have a family member who has a known comorbidity or is on any kind of immunosuppressant medication, it is the most advisable that you go to the doctor at the soonest possible. I hope that answers your question.
Thank you, ma'am.
Any other questions? Okay, since there are no more questions, we will be concluding this event by thanking all of you on behalf of YRC Kit for joining us and making this event a success. A Google form will be shared in the chat box. Please fill it up with the correct details to receive the e-certificate. Also follow our social media handles for more details and updates in the future. The link will be closed after 5 minutes. Please fill it up quickly. Guys, we have very few responses so far. If you want the certificates, please fill it up. We'll be closing the form by 4:37. Thank you. Yeah, Vaishali, go ahead.
Sorry for the late question, but it's a little unconventional. How helpful are the mosquito repellents like Odomos and all that are available in the market for the prevention of these diseases?
I think the ones that are commercially available aren't always very helpful in the sense that mosquitoes develop inborn resistance to them. But uh, I think it is still better to use them than not use them at all. I mean, even if they produce or provide like a 50% protection, then you are better off. And another thing that I've noticed generally is to keep changing the repellent that you're using. Suppose if you're using one brand or one kind of repellent for quite some time, then you can shift to another version. Uh, Preferably the mosquito the creams or the lotions might not be that good, but the ones which have oily consistency generally tend to work well. But then again, this is not a very medical question, and I'm not very sure it's a commercial thing mostly. I hope
Okay,
that
thank you so
answers
much.
your
Yeah, yeah,
question.
yeah. Thank you, ma'am.
We'll be closing the form in 1 more minute. So if you haven't filled it up, please fill it up fast. Okay, I'm closing the forms now. So the link has been closed, and we thank you all for joining. We would also like to extend our thanks to Dr. Meghaparna Mandal for a very useful discourse on the topic, which I feel will be very helpful. This event would not have been possible without the help of all the members of the YRC KIT team. I would like to thank all of you for your support. You have made this event a great success. We will be conducting many more such awareness programs in the future, so please follow us on social media to keep up to date. And I hope to see you again soon. Thank you. You can leave now. Thank you for joining.